My name is Steve Mowle. I'm the Treasurer here at the Royal College of GPs, and today I'm here really as the Deputy Lead for COVID-19 in the College.
Hi, my name's Martin Marshall. I'm Chair of the College and a GP in East London.
So Martin, the first question I'd like to ask you, lots of members are writing in and they're asking this simple question: what is the College doing to support its members during this COVID challenge?
So this is a massive challenge for the College, and one that we're rising to. It's so important that we prove ourselves to be useful for our members. We recognise probably the most important thing at this stage is information. There's nothing worse than the information vacuum, and I know a lot of clinicians out there feel like they just don't know what's going on. And the main way that we're responding to that at the moment is through the development of the website. So we've got a COVID-specific part of our website. We've got a number of resources that we're developing on that website, and it's available there for people to look at right now. Some of those resources relate to frequently asked questions, so we've gone out to our members and said, what are the key issues for you? We've taken them back to a clinical advisory group that we've established, and the answers are there. I've also put national guidance on the website as well, so that it's available there in a simple, accessible form, and in parts we've had to adapt that national guidance as well. So that's one part of the website. The second part of our website is CPD resource. Our RCGP learning team, which is a phenomenal team, has developed some really good, really useful practical resources related to clinical and practice management issues. And the third part of our website is going to be a discussion forum, which we're establishing very soon, which will be chaired by our President, Amanda Howe, and that's going to give members an opportunity to exchange ideas and to have question and answers as well.
Martin, so what sort of conversations have you been having with government ministers and senior leaders within the NHS recently?
Well, one of the most important roles of the College is our ability to use our links, our networks, our influencing opportunities with government, particularly at a time like this. So we're working closely with government. We have an effective working relationship with them. We're supporting them at a time of great need. We need to work together as a team. Often we're providing some very practical advice for them, helping them to write guidance, for example. But at the same time as being supportive, we're also in a position, because we have an effective relationship, we're also in a position to challenge them. And there are a number of really important issues on which we are challenging them. For example, current guidance about the isolation of people who possibly have been exposed to coronavirus, but they're not sure. They're detached from the workforce. They really want to be in there supporting their colleagues, so we're challenging them about that. We're challenging them about self-testing, so that people can be tested and get back into the workforce as quickly as possible as well.
And are there things that you think the College has actually achieved through these negotiations?
Yes, very much so, and I think that's a consequence of a good relationship that we have, and the respect with which the college is held. So, for example, we push very hard for the Care Quality Commission inspection regime to be stepped back, and that's happened, which is great. We've pushed very hard, along with GPC colleagues in the BMA, to reduce some of the contractual requirements. That's happened as well. We've also encouraged educational colleagues to step back on annual appraisal. That's happened as well. So I think in a range of different ways, because we're respected, we're making reasonable offers, those are being listened to and they're being acted upon.
Great, thank you. So is the College doing enough then?
Not yet. We understand the enormous pressure that general practice is facing, the stress that people are feeling. This is a massive crisis for all of us when you can see your colleagues going off unwell, and you know that it's going to get worse before it gets better. It's a massive challenge for us. We're doing our absolute utmost to respond to that challenge. We are producing more and more information which we're putting onto our website. We've got a whole range of ideas about how we can engage with our members and support our members, both emotionally as well as in terms of information. We want to improve the quality of the information, we want to improve its presentation. We've got a lot that we need to do, and we're working on it really hard. We're going to get there.
Brilliant. Thanks, Martin. Martin, do you think general practice is ready for the next few weeks?
Well, that's a really big question, isn't it? Because this is a massive challenge. This is the biggest challenge that general practice has probably faced for generations. It's the biggest challenge the NHS has probably ever faced. We know that general practice are gearing up, they're getting into the right place to be able to deal with this. We also know that it's a massive challenge and there's lots of things that are required, some of which are within and some of which are outside general practice control. We need more guidance, we need better equipment, a better technology, in particular personal protective equipment. We need to make sure that we've got enough to deal with what is going to be a crisis which is getting worse. We're going to need to use PPE more. We need better technology, particularly to help us to do online consultations as well. So there's a range of ways in which we need more resource to allow us to really get into an appropriate state of preparedness. My feeling is that we're going to get there. What we do have to remember though is this is the biggest crisis that we have probably ever had to face, and we have to remember that it's going to get worse than it is now. The peak of the crisis is probably going to be a few weeks, maybe a month or so away. By that time we need to be really prepared as we possibly can be to deal with it.
Thanks, Martin.